Hello, welcome to Being Your Own Health Advocate. This is the class to teach you how to empower yourself to take control of your health and your health records. We're going to have a few words today. I'll be giving you more information about myself, why you should be your own health advocate, going over the trust but verify portion, which will include discussing side effects, research, and questions. We'll also go over record keeping, what records it's important for you to keep on hand, especially if you're pursuing a difficult diagnosis or chronic illness. And finally, that your body is your ultimate authority and to never be afraid to persist in getting your questions answered. So my name is Samantha Francis. I'm a licensed acupuncturist in Maryland, and I'm nationally board certified in traditional Chinese medicine. The passion that I have for Chinese medicine comes from my experience with Lyme disease and about learning how to empower myself in my healthcare. And so I want to share some of that knowledge with you today. So this is a picture of the spirochete that causes Lyme disease, Borrelia burgdorferi. And this spirochete, it looks so small, but it can really cause a lot of trouble in your system. My diagnosis journey started in 2004, and it took about 18 months for me to get a diagnosis of Lyme disease. And I never had a positive test until I had already been on antibiotics for 3 months. It was a really long and frustrating process to get diagnosed. I saw about a dozen different doctors. At first, they thought I had MS. There were some doctors that just thought it was all in my head and that I should go see a psychiatrist. And it was just a very difficult time for me. And I sort of explored and learned the limits of what Western medicine could do for me, and learned that I really needed to bring a little more to the table in terms of advocating for myself and not just giving up and rolling over. And this information really saved my life. If I had not continued to pursue diagnosis, I would have been either in a wheelchair and completely disabled or dead. So uh, it was pretty important to me, and I'm hoping this information can help you today in pursuing your own diagnosis and your own healthcare problems. So why is it important for us to be healthcare advocates? There's a few reasons. Doctors don't always have all the answers. They're human too. I saw 3 different neurologists, and they really weren't sure, even among all 3 of them, what I had. Even based on lab tests and imaging, they really were confused. And so it's good to kind of know that hey, they're human too. They do the best they can. They keep up on research and reports. Um, and honestly, a lot of them got into medicine because they want to do good and because they want to help people feel better. They just don't always have all the answers. And so it's unfair of us in a way to expect them to know everything. We have to be sure that we bring our own information to the table. The other thing I want to mention, especially with all of the healthcare reform and all of the turmoil in the healthcare system, is that the time that doctors can spend with patients is getting less and less. If they don't see at least 30 to 40 patients a day, and in some practices much more than that, they aren't making enough money for the practice and they could lose their job. So it's something to consider that they really have to be focused on the time being what it is and taking the least amount of time with you. And it's not that they don't care, it's that they're constrained by the system that this is what they have to do. So we want to be able to make the most of our time with them. The other thing I wanted to mention was iatrogenic death. So that's death that's caused by wrong diagnosis or medication. Um, this is one of the reasons why they always tell you to have all of your drugs filled through one pharmacy, is so the pharmacist can assist you in not having any sort of issues with your medication. But it is the 3rd leading cause of death after heart disease and cancer. It's even more than auto accidents, which I found somewhat shocking and surprising. But it definitely shows you that there is value in looking out for yourself. So the final reason why we need to be health advocates is that it empowers you to take control of your own health rather than waiting for instruction. So the day where you could go see kindly Doc Smith down at the corner and he could tell you everything about you and that he's known you since birth, those days are pretty much gone. Even if you see a primary care practice, it's entirely possible that that doctor may leave and you may have to go in with a new doctor, even though it's in the same practice. And it's really much more dependent on what's in your record, what information that you've shared with the doctor, and it is also dependent on your attitude, whether you are hoping to be fixed like a car, or whether you recognize that, unfortunately, we're not cars. If our engine falls out, we're in a lot of trouble. It's not like we can just go and get a new engine installed. So it's about recognizing that we have a power and we also have a responsibility to ourselves to take good care of ourselves. And everything in healthcare going forward is pointing more and more towards putting more responsibility on people. In some companies, they're even having people sign up for fitness and wellness programs, and if you choose not to participate, you're going to be paying more on your health insurance. So that kind of thing is going to continue to grow, and it's good for you to know about it and to be ready for it. One of the ways that I like to think of this is called primary care is self-care. So rather than instantly thinking when something's wrong, go to the doctor, you still want to go to the doctor if you think it's an emergency, obviously, but you also want to start looking at what can I do that is preventive medicine for myself. So now we come to the trust but verify, and what I mean by that is that you should trust your doctor. You should have a doctor that you are comfortable working with and that you feel is there to answer your questions and is really helpful with you, and that knows enough to help you. But you should also verify what they tell you. They mean well, and they don't always know the whole picture of what's going on, especially if you're seeing one primary care who should be coordinating your care, but unfortunately, because of time constraints, they're not always able to get a full picture. So you should be seeing that primary care doctor, but you're also going to have other specialists that you might see, especially if you're tracking down a chronic illness or trying to figure out a mystery diagnosis, and they don't always all talk to each other the way they should. And in an ideal world, they should all be sending each other notes, and your primary care should be sitting down and going over your file on a regular basis, but that just, unfortunately, does not happen as often as it should. So this is just about you kind of taking that extra step to become knowledgeable about what you're on, why, what the plan is, and just informing yourself a little more as to what's going on. So the first step that I have in the trust but verify process would be looking up prescriptions. So when your doctor writes you a prescription or sends it off to the pharmacy to get filled, it's really a good idea before you start taking the drugs to look up what the side effects are and just make yourself familiar with what the possible side effects could be. You can also look up other information like whether it's contraindicated for a condition that you might have, or it's against or working against one of the other prescriptions that you might already be on. And again, this is why you generally want to try to have all of your prescriptions filled through the same pharmacy if possible. And sometimes it's not possible. Like, for example, you're on long-term medication for something chronic like asthma, but then you also get bronchitis, and so you need to have a prescription filled for antibiotics. It's good to make yourself aware of what the side effects are of the antibiotics before you take them, and especially since you're probably going to be going through two different pharmacies if you have a mail order pharmacy for your chronic meds and then a same day or a drugstore pharmacy for this one-time only med. So it's just important to kind of look things up and just become a little familiar. Obviously, your doctor and your pharmacist have the primary responsibility here, but it's just kind of good to double check. And the link that I've given you here is the link to Medline Plus. This is a resource that was developed by the National Institutes of Health and the National Library of Medicine, and it has really good information on most of the drugs that are available. And rather than just looking up randomly, this is a peer-reviewed information, and they definitely tend more towards the conservative side. So it's just a good way to get the very solid, science-backed answer to your question. And it will tell you, all the information that you need to know. It'll also have warnings on here if needed. So that will help you. And then the next part about trust but verify is researching conditions and diagnosis. If your doctor comes up with a diagnosis for you, it's always a good idea to go and look that up online if you can. And again, Medline Plus is still the resource for this. And you can look up under health topics, and it has a very, very thorough list with links not only to NIH resources, but also to the Mayo Clinic and other outside resources. There's even videos out there that will sort of explain a disease process or explain what the function of something is in the body to help you get a better understanding about what's going on. And once you've researched that, the next time you go into your doctor, you'll be able to bring a good list of questions to ask about your diagnosis, your treatment, your prognosis, how they think you're going to be doing going forward, and just all these other questions you might have. So now we get to the record keeping section, paper or plastic, as I like to put it. So your record access and availability is changing really rapidly. Part of not the ACA, but other recent changes in Medicare have required doctors to go to an electronic health record in their practice. And a lot of times in those practices, you can access those records online. And that works great to access your primary care's records if they have it. Again, that's not an assumption that they're going to automatically schedule that with your specialists and other people that you're seeing, but it is a great tool for you to use to just keep track of your basic needs. I, back in 2004, 2005, started using a binder with paper, and I still really recommend this, especially if you're working with older patients or those who don't use or have access to the internet, or if you're chasing something that's really complicated and you have multiple doctors. Unfortunately, we don't have an all-in-one electronic health record right now that's commonly available that all doctors use. A lot of doctors use different systems, which part of that is they're required to use a different system because of HIPAA, but they're also, which is the privacy practices they make you sign when you come in, but it's also about different doctors use different software, and they're not all necessarily compatible with each other. So, right now I still think a paper backup is your best bet. Obviously, in the next 5 to 10 years, they're probably going to be coming out with a lot better and more affordable options where you can have all of your electronic records on one item. But until they do, I still think paper is the best way to go. So how do we set up our binder with all of our health information? So up at the front, I think it's a really good idea to have a page with all of your prescriptions on it. You want to update it every time there's a change. What you want to have on this list is the drug name, the generic name if you have it, the dosage, as in 1 pill twice a day, 3 pills, 3 times a day, etc. The reason why you're taking it. Also under the dosage, you want to have how many milligrams or what the amount of the pill is, because sometimes those pills come in different forms. And sometimes if you're dealing with an older patient or yourself, you can even include pictures of the pills and a description to help reduce confusion, so that when you're filling those pill boxes, or they're trying to figure out if they're taking the right dosage of things, it's easier for them to figure it out, that they know, okay, I needed to take the blue pill and the green pill this morning. Sometimes it's helpful to have a visual cue for that. The other thing that's really helpful to include is a medical history, especially for older patients, those with a lot of surgeries or a history of trauma. It's really good to keep an updated and typed copy in your binder that you can hand over to new doctors to review. It saves time, and it also saves your memory from having to remember everything that's gone on. And especially if you feel bad and you're in a chronic illness way, I know with Lyme disease my memory was really, really, really shot, especially my short-term memory. So it was really hard for me to remember all the tests and everything else that had happened. So having a medical history with, as close to month and year and day as possible of different incidents was really, really helpful for me and for my doctors to make the best choices for me. You also want to get a copy of your lab reports from each doctor and organize them chronologically, most recent first, to avoid repeats. There's certain common labs that your primary care is always going to order. There's also other labs that maybe be a little more complicated or a lot more blood that they have to take. So just to make life easier on you, it's a lot easier when you have those labs in front of you, and then if you go to the specialist and they say, I want to order XYZ lab, you can say, well, my primary care has that already, and here it is. Here's a copy of that report from last month. Or you can even, have the labs to show and say, here are my most recent labs, doctor. Would you be willing to flip through these and see if these cover what you need? And the doctor's happy because they have the results right there, can make a decision right there, and you're usually happier because you're giving less blood. Next, it's good to have a section for imaging. Not necessarily your films, I'm talking about the verbal reports that the radiologist or the other specialist will give about your test results. They usually send this to your doctor after you've completed your imaging study, and those are really great to get a hold of. Again, some of these EHR software, they'll let you access everything. Sometimes they don't, so it's something to kind of check back with the office to make sure when you go in for that follow-up to get a copy of that study, and just put that in your file. It's good to have a section for pending items, basically your homework. Any new lab orders that you get, new prescriptions to look up the side effects and add to your prescription list, any referrals to new doctors that you get, and just any other actions that you need to take in regards to your health. Especially this is good to also have in their lifestyle changes. If the doctor recommends getting a sleep study, or the doctor recommends seeing a dietitian, it's good to have those orders all in the same place so that you have a list to work from. It's also good to have a section for your practitioners, especially if you're seeing multiple ones, a page with their names, phone numbers, address, fax number for all the doctors that you've seen, and what you're seeing them for can also be a helpful reference for you. You know, most people, you might be able to remember that an endocrinologist is who you go see for diabetes or thyroid or other issues, but if that's a little hard to remember, or you just don't want to have to try to remember it, it's good to kind of have a section of, this is my primary care, I see this guy for my heart disease, I see this guy for my diabetes, and so on. So it's good to kind of have yourself organized. It's good to have a section also, you can kind of combine this with the practitioner section if you like, of questions for your next visit with that doctor, so that when that question arises, you can write it down in your binder, and then the next time you go in to see your primary care or your specialist, you have that list of questions ready to go for them. It's sometimes handy to have some insurance info, at least some information about your copays, just so you're aware. Honestly, these insurance plans, change so often. If it's something more complicated than an office visit, you're probably going to want to call them or look them up online and see what your actual costs will be. But it's handy to have that information in front of you. If you have a website account, you can have that link available in this section. And you can also have links to other information your insurance company may provide about your specific condition and how they support that. For example, United Healthcare has a website where they will tell you more about diabetes and give you more information. And my final thought on this is, one day hopefully this will all be online, but you're still going to want to review it periodically, because every time there's a prescription change or a new imaging study, that might change the picture a little bit, and you also want to add that study to your health history. If it finds something new, you're also going to want to check that prescription change again for any side effects or any ongoing concerns with that. Alright, saving on copays and lab fees. We all like to save a little money and save a little time and trouble for ourselves. So when you have a recent lab that's already done for the doctor to review, then you don't have to order a new one. It saves you copays, and the other thing I'll put on there is it saves you blood, fluid, time, and trouble. When you get your questions answered on your regular visit, then you don't have to do emergency visits as often. And again, you're more empowered. If something does go wrong, you have an idea of what might go wrong and how to handle it. Finally, you also want to learn who to contact in your doctor's office when you have questions, and ask the best way to do that. Sometimes some doctor's offices want you to phone the nurse, sometimes they want you to email, sometimes they want you to use an online portal now. That's becoming more and more popular. And it's good to find out what is the best thing for which question, because you might have a question about your care, you might have a question about billing. And again, those are contact information points that you can put in your practitioner section in your binder. And finally, remember, your body is the ultimate authority. Here's what I mean by that. Doctors can only do and know so much. They need you to be proactive. And more that's going to be true. As the system gets more overloaded, there's going to be less time available to go deep and really go over your records. So you really want to take a look at this seriously. If your doctor is not willing to partner with you and doesn't want to answer your questions, you may need to find a new doctor. Not every doctor is kind of open to this health advocacy movement, and some of them just want you to come in, be compliant, say, yes, doc, take their pills, and leave. It's kind of weird because it's really more helpful to them if you're proactive and empowered, but some doctors they just don't want to deal with it. So just be aware, if you start doing this and your doctor gets really grumpy or upset with you, they may no longer be the right doctor for you. And I also say, don't be afraid to look up alternative treatments. I'm not saying just go out and do whatever crazy thing you find on the internet, but you can always ask your doctor about them, and look up the studies and the science behind some of these alternative modalities, like, for example, acupuncture, and see if it's something that might work for your condition. Finally, the biggest thing that you need if you're pursuing a difficult diagnosis or a complicated situation is persistence. If you know deep down that something is wrong, don't give up until you have answers. There's been numerous stories going around online about people who were told one thing and then it turned out something completely different had happened, and they ended up dying because of misdiagnosis. I'm not saying this to scare you, I'm just saying this to get you to wake up to the idea that if you feel like something's wrong and you're not getting the care that you need, and you feel like no one is helping you, you need to keep going. You need to keep trying, keep calling the next doctor, and if you need help, reach out. See if a friend or a loved one would be able to help you call people, make the appointments, and take care of all of this, because this can be really, really difficult to handle on your own. But it's important. It could actually save your life. Now, depending on where you are in life, maybe that's not as crucial as in other points of your life, but for most people, that's enough value to make it worth your while to keep going. So finally, if you have questions, you can certainly contact me. Here's my email address, my website, and my phone numbers for my Brunswick practice and my Greenbelt practice. Anyway, thanks for listening to this video, and I hope that you found it helpful. Take care. Bye-bye.